you really just take a tour of the Facebook group for the school. And remember, over in files, you can find study guides for almost every chapter. You can find some videos as well. And the courses, for different courses. So we are live streaming. And prepare to share the page. All right. We got something going on in the chat. Hey, Shanique. Yes, I just want to say praise God on behalf of Miss Shirley. Yes, y'all, when I tell you my feet was so happy. My feet was so happy. It was just an amazing feeling that overwhelmed me and my family last night. That we come a long way, and I know you guys have had a motivation, but it's just a test of your faith. It really is a test of your faith. And I told my mom last night, we don't know what's on the other side, but God has been good to us. We do know right now, um, our faith had to be strengthened even more. And then she had to have faith and not give up. So, y'all, it's been a long journey. But when I tell you, um, we're going to be all right. We are going to be all right. So, thank you. And I appreciate you, Shanice, for your prayers. Thank you. Thank you. My students that text back last night, I appreciate you. Thank you. Yes. Y'all are amazing. Thank you, Miss Candace, for holding me down the many, many nights. I appreciate you. Y'all, let's move into one of my favorite topics. And we're in chapter 4, blue book. I mean, blue, if you're in the the portal, you will see the blue boxes. That's the boxes we're in. We're in chapter 4. And in chapter 4, which is I see Jemiah on here who will test in Mississippi. It is going to be very significant. Chapter 4 is going to be very significant to your particular test. And then when it comes to aesthetics, it's going to be significant as well for Tennessee. But Mississippi definitely, I'm glad that I recorded this. You'll be able to go back and just kind of listen to it at your leisure. All right. And so we are going to go into, we're talking about acne. We've reviewed lesions. We talked about cancer, skin cancer, and things of that nature. So yeah, let's go into a video of acne 101, and then we'll go into ebook activities. There are 4 grades of acne. Let me pause here. Can you put a 1 in the chat if you can hear? Give me a 1 in the chat if you can hear this video. Okay, you guys couldn't hear. So what I'm gonna do, I'm gonna stop share. Okay, you said it's low. That's exactly what I needed. I'm going to go in and enhance the sound. Okay. And we should be working. Let me go back here. Here we go.
There are 4 grades of acne. Its severity is determined by the number of lesions, comedones, papules, pustules, and cysts. Grade 1 acne is characterized by minor breakouts, mostly open comedones, some closed comedones, and a few papules. Grade 2 acne is characterized by many closed comedones, more open comedones, and occasional papules and pustules. Grade 3 acne involves red, inflamed skin, and many comedones, papules, and pustules. Grade 4 acne is cystic acne. Cysts with comedones, papules, pustules, and inflammation are present. Scar formation from tissue damage is common.
All right. So what I wanted you guys to see, I'm gonna hit a pause here.
Its severity is determined.
All right. So the first thing we learned about acne, there are 4 different grades. So there's 4 categories of elevations of acne. All right. And as an esthetician, this is going to be your number one thing. This is the aesthetic of the largest organ of the body, skin. Skin is also your specialty. And so I really need you to hone in on acne. I also need you to be one like your teacher, a people watcher. And a lot of times I train my eye by just watching people, as far as variations in hair color, variations in skin. And so you may say, I don't have nobody to practice on every day that you go out. Every day that you go out, and every day that you are somebody's customer, you're somebody's consumer. And so when you are giving them currency, you're buying something, you should be getting something back also. So simply what I mean by that is you should be looking at the skin. You should be sparking up a conversation. You should be asking them, where do they go? Who's their esthetician? What kind of skincare? You should be sharing what you do. Okay. I know that's a lot for some people, but remember you're going to be a service provider. So you got to start now just asking questions, and sometimes the breaking the ice is you asking about their skin. They may have not wanted to. All right. So it's showing yourself kind and asking questions, or just simply observing, doing your own analysis, and you're just waiting to the point. Maybe you got your favorite person that fixes your drink at Starbucks, and you've noticed some acne issues, and you go there 2, 3 times a week, maybe you see this person. Maybe the next time you go, put it in your mind, I'm going to ask them about this. And I'm going to tell them what I'm going to do or what I do, and I'm going to slide them a card. But how do we do anything? We need to know the difference in what we're looking at, okay? When I say the difference in what we're looking at, because acne is characterized by grades, okay? I don't want you all to say type, okay? Type is set aside for Fitzpatrick, and type for skin types, okay? I want you to say grade. So it's acne grade 1, acne grade 2, acne grade 3, and acne grade 4. It's your job to learn the difference between 1 and 4. So in showing pictures, you should also be able to know the difference just simply by the pictures. So what I'm gonna do, you saw the video, I paused it on this one, okay? And you guys know how I am. If you look at this video here and it's this picture and it says acne grade 1, I don't want you to give me something out of the book. I'm not looking for educated guess, educated answer that just word for word out of the book. No one learns like that. Okay. Well, some people may, but most of my students do not learn like that. You're visual learners. And so when you've been visual learners, I need you to be able to give me a summary of what's going on. And I want you to do that by simply telling me what you see. Trust in the knowledge that you already know, and just tell me what you see. And so I want you to communicate in the chat. This is acne grade 1. Tell me what you see. Be one word answers. Tell me what you see. You got to learn how to trust your gut. Tell me what you see. From your knowledge you already have now, what do you see? I'm going to the chat. Inflammation, yes. Now, here's the thing, Brittany. When you say inflammation, in my mind, I see sensitivity and redness. So yes, this person could be the next thing, could have they could go up and inflammation is going to be present more so. I do see some redness here, but remember when you see or you say inflammation, something is very sensitized. That person may have just a little pain around it, and you're gonna see redness. Okay, so you do see some redness, but at this point, it's not inflamed yet. Okay, it's not inflamed yet. Let's go back to the chat. Yes, red bumps, milia. Okay, okay, yes. So I do see some sensitivity and I see some redness. Okay. And I see these little bumps here. Milia. Okay. Milia is simply just a, a composition of oil sweat, dirt trapped underneath that hadn't really come to the surface yet. Also, it could be accumulation of someone who has a sweat disorder or oil glands disorder. But guys, when you see a lot of oil, you're going to see a lot of this. When you see a lot of heat, you're going to see a lot of this. So close your eyes. Let's look at it again. Could this also be a person who has a heat rash? Allergic, somebody who's allergic to something? Could this possibly be that? There's so many possibilities. Could you see this? Yes, yes, yes. Okay. So I just wanted you to train your eye. So grade one starts you to look at things a little closer and you start to say, hey, what's going on? Do we have allergic reaction? Okay. Do we have a lot of oil buildup in some areas? Has this person been sweating? They work in a warehouse. Have they been touching their face with dirty hands? Have they been wearing, like a dirty cap, dirty headbands, things of that nature? And so we want to come to what causes this. And if you know young ladies that are guys now that wear extensions, sometimes you will see this on like the cheeks and the forehead because they may be allergic to the hair. Okay. So braiding hair is made of plastic, monofilament fiber. And so sometimes you have individuals who are allergic to that. Also, this could be a result of someone who may be allergic to latex or medication or cream. Okay. Whether it may be a topical or something internal. We will have to do a more detailed analysis with this client. But guess what? We don't have any open lesions. And so grade A acne can be treated by you, the esthetician. Once you usually correct the thing in this form of acne, this client is going to be A-okay. Okay, that's grade A. Let's go on to the next one.
Determined by the number of lesions, comedones, papules, pustules, and cysts.
Okay, so comedones, they are either open or closed. They're either blackhead or whitehead. You have some that have not come to the surface. That's where you see milia. Okay, and let's go over to grade. And a lot of what you see is called papules. And papules is what people call bumps. But as estheticians, we don't want to use the word B. We don't want to use the B word because you can't get paid at your highest using the B word. So we don't want to tell a client we can bust their bumps, but we can definitely treat their papules. Okay. So make sure we have that professional note.
Grade 1 acne is characterized by minor breakouts, mostly open comedones, some closed comedones, and a few papules. Grade 2 acne.
All right. So before we hear about grade 2 acne, what do you see? Trust yourself. Put it in the chat. What do you see? Something's bigger and you see more. What do you see? I see more redness as well. Irritation. Okay. Looks a bit shiny. Because now we're starting to see, so we're going to start seeing what we see underneath come to the surface. And it's going to come to the surface in the form of a pimple, and it may also have pus in it. So now we're getting close to that inflammation. Yeah, the texture, oh my goodness. You see the texture? And a lot of times, clients that have this on their shoulders, they have this on their backs. They may have this on their face, forehead. A lot of times in the facial process, you got to make sure this client does not pick. If this client starts to pick, they're going to leave scarring. And as you start to heal, you'll always be able to see what was there before. Okay. So you're going to make sure you stop picking that stuff at this stage. But let's listen ahead.
Is characterized by many closed comedones, more open comedones, and occasional papules and pustules.
Okay. So open comedones, this client will, once the skin softens, they will get extractions. Okay. Now you have papules and pustules. So you have milia. Okay. You have, which is the harden underneath. You can feel it. And now they're starting to come to the surface. All right. And pustules, that root word pus, you will start to see what we call pimples. Okay. Everybody knows what a combination I like to do. If you're going to do extractions, you need to come behind the extractions with a high frequency. The high frequency is going to kill the bacteria. It's going to minimize that pore, get rid of that oil, and it is going to shrink these bumps and pustules and things of that nature. So by the morning, you never know that it was there. It's going to improve the texture of the skin. Okay, improve that texture. Let's go to the next one.
Grade 3 acne
All right, let's look at grade 3 acne. Now, yes or no? Can we use the word inflammation or inflamed skin now? Put it in the chat. Yes or no? Yeah, can we use that term now? Inflamed? Yes, yes, yes. Yes, we can. And that's all we needed to do is to train our eye. 1 and 2, and then look at 3. Can someone unmute and tell me what the difference is that they see? Just there's no wrong answer. What do you see the difference between 1 and 2 to now?
You actually see those pustules. You can see the pus in them.
You can. They ready to go, ain't
Yes, those are
they?
ready for extraction.
Ready for extraction. So even though you're going to do extractions here, definitely come back behind with something cool, because when you see inflammation now, you see the client may have some pain. Whenever you see, you may also feel heat, and this area is very prone to infection. So I will come back, make sure you're making sure everything is clean, because you don't want to carry bacteria to an area and make it worse. You make sure everything is clean. And also, you want to dry this area out. And when I say in your treatment, dry out, we want to get those extractions out. We want to get rid of that pustule, those pustules. And then we're going to go in high frequency. High frequency is going to eliminate the redness. And these pimples you see that are raised, they'll be flattened down. We want to also minimize scarring. Now, take someone that has anxiety, Take someone that's nervous, is taking a test. What are most people that are nervous? They bite their fingernails, they find something to pick at, right? But you want to make sure your client does not do this to their skin because it could last lasting impressions on the texture of their skin for a long time. And if they're going through puberty, this is the skin that they would likely carry over into adulthood. Okay, so we want to make sure that that we also, as we treat, we reduce scarring. All right, there are treatments that can help with scarring. There are treatments like once this dries up and you still, it's going to turn into spots. It may turn into spots or something that's left on there. This is where I would say, okay, micro needling and chemical peels could come into play once this area is not inflamed anymore. Okay. And the reason why I say that, it will pull up new, will dry this out and pull up new skin. All right. So 1 and 2, not so much ready for chemical peels. You may need to do a deep detox enzyme, but definitely we can start discussing chemical peels at 3 and 4. All right. And so we've still within our scope of practice as an esthetician and a cosmetologist, we're still within our scope of practice. So we can serve this level of acne. All right. So let's listen along.
Involves red, inflamed skin, and many comedones, papules, and pustules. Grade 4 acne is
Somebody want to just look. What do you see? What do you see? Trust yourself. What do you see? And as you're talking to this person and they're telling you what's going on with their skin, I'm kind of listening, but I'm going to ask questions again. So I'm not really paying attention to what they're saying right now, but I am looking at what I see and I'm trusting what I see. They can't lie about what I see. All right. And as you ask your questions, you will start to get more answers, or you ask them to repeat different things. But I am starting to look at what I see. Do anyone want to unmute and just tell me, what do you see now, grade 4, that's different from the rest of them?
Rosacea.
And what comes along with rosacea? Tell me.
I see small cysts.
You see small cysts? Yeah. What comes along with rosacea?
Redness.
Redness, okay, and the S word, sensitivity. Okay, this client, your products may work amazing on everyone else, but you're going to have to be 10 times as sensitive and aware of what you're putting on this person's skin. If this person's skin is not toned properly, or if something causes the skin to be irritated, it will not allow you to finish the service, because every time you touch or try to rub, it's going to send a sensation to the client, and the client is going to think their skin is burning. Now, who's going to allow you to keep touching their skin if they feel like it's burning? All right. So we don't want them to be sensitized at all during any facial or any grade, because we want to get down to the end. And the end is where we can show some real driven results. And so everything that you guys stated, that's a part of grade 4. Now we have to make a decision, guys. Should we work on this client, or should we pass this client now to a physician? What physician?
A dermatologist.
There you go, a dermatologist. And you and the dermatologist now start to work together in this treatment plan. Okay, because this could be coming from, well, any of it could come from medication. But what's going on here? A person might have to take something by mouth, a medication. They also may have to be prescribed a topical cream. Now, this medicated topical cream sometimes have retinol in it. And if this client gets other services like waxing, you will not be able to do waxing. You may have to go to another type of hair removal. But if this person has like a retinol cream to help them with cystic acne, what happens with retinol cream, Soon as you start to put it on, it becomes a berry that attacks these cyst areas. Okay. um what it attacks it like this, it softens the skin. It's work and it softens the skin. So as it softens the skin, yes, you have your maintenance cleansing facials, but it's over a process of softening skin, minimizing the pores by the product minimizes the pores to get rid of the oil first. Once we get rid of the oil, we can now start to clean the area. But as long as the oil is there, as long as the pores are enlarged, more oil is going to sit up, which is going to cause more acne. All right. Acne's worst nightmare is oil, sebaceous gland. I mean, the oil that you produce, sebum. All right. Because the more oil that's produced, naturally, you start to enhance or enlarge the pores. I asked Siri that. Okay. You start to enhance, or so you want to minimize the pores. If you minimize the pores, you can also minimize the oil. And once you get rid of the oil, you'll start to have a healing process for the acne. All right. Lord help those who are severely oily skin or who has a deficiency that they have overactive sebaceous glands. They're always going to be in a detox. So they're always going to be having something that pulls oil out. In products that include sulfur are going to be great, like a sulfur mask. I'm just recommending something are going to be great for this particular client because sulfur is what the hair, skin, and nails is made up of. And anytime you put back onto the hair, skin, and nails, what makes it up, it starts to improve. And so have you all ever used, like your grandmother had a sulfur-based product that they use in your hair or something back in the day? And you wonder why it works, but it stinks. Your hair, it felt like home. It felt like the scalp was home because it's all made up of a piece of sulfur. It's made up of carbon, hydrogen, nitrogen, oxygen, and sulfur. Okay. And so they call those cones. See, any hairdressers in the house, they call those cones, but sulfur-based products, and usually you'll find it in a mask, would be amazing for this client. It's going to pull up, it's going to detox that pore and pull up all of that oil. Okay. And if you're on the West Coast, they use something called volcanic ash. And the volcanic ash is healing to the skin because it includes sulfur. And so once you start working with body products like mud, doing body wraps and stuff, you'll start to learn about the earth's elements that help improve the skin. But you may have seen people go to spas and they have all that ash all over them. That is sulfur. It really complements the skin, and it's a treatment used in this severe form of acne. It's a sulfur-based product. Okay. Also, a tar-based product. Sulfur and tar, they don't smell good, but they're very healing and they're very great in treating this and getting it under control. So definitely we will refer to a physician. Once the physician treats them, then we'll be able to follow from the physician. Remember, we can't diagnose, but we can say, hey, this may be a little bit too far. I'm seeing some things. I need you to go to a dermatologist. Once you go to a dermatologist, we can put our plans together and, excuse me, this is going to be the plan for the next 3 months, next 4 months, next 5 months, so on and so on. But before I close here and go to PCOS, I want to discuss with you what I was talking about with the retinol, because you have a lot of clients who are aging. They use retinol to help improve the skin from wrinkles and from acne. The retinol softens the skin. It improves the skin, but if you go and get a wax, that wax is going to pull off the skin. So this is why retinol is a contraindication to waxing. All right. So if anyone is seeing a dermatologist and they have a product, their prescription for something on the face, we are not going to wax. And so this is another reason why you got to ask questions and just find out where we at with a whole lot of stuff. Okay. Any questions about grades 1, 2, 3, and 4? Put your questions in the chat. I'm gonna go ahead and hit play, but put your questions in the chat.
Cystic acne. Cysts with comedones, papules, pustules, and inflammation are present. Scar formation from tissue damage is common.
All right, so it says scar formation from tissue damage. So we want to improve the scarring. There are treatments that you can do in medical aesthetics that will improve the scarring. All right, so such as laser treatments. And that's gonna, or you ever heard of laser resurfacing? And so that's simply almost like sandpaper going across the skin, a similar machine like dermabrasion, a dermabrasion machine, going across that scar area. But just think of it as a laser, and it's trying to smooth and even that skin out. So very interesting. If you specialize in acne, you will forever have clients because people are going to deal with some type of skin issue related to acne, whether it's from an allergic reaction all the way up to grade 4, 6 acne. But if you study hard and read and train yourself to see, trust yourself with what you see, and then you start to say, okay, how do we solve these things? All right. Questions?
Would aloe vera be okay on acne prone skin or people that are suffering acne to soothe?
Yes, aloe vera is naturally cooling. And so anything that's inflamed will have heat behind it. And so aloe vera comes in to soothe that. So aloe vera is amazing. There are different types of aloe vera, but aloe vera is amazing. You can have, I would suggest you take a plant and just leave it in your salon spa suite. And when you got to go to it for emergencies, just take it off. That fresh aloe vera, amazing for the skin. Sometimes, y'all, we can see these cystic acne or these different grades, and these people will go to the beach and get sunburned. How about that? Then you're trying to figure out which is which. You got to you got to figure it out what's all of it. You got to do one at a time. But aloe vera is going to be great soother and blocker. It's kind of clear consistency other than the pigment of green added to some, but doesn't have many blocking agents, but it's a soothing agent. So it will calm your client down. Also, the little globes, we got some at school. You can set them in ice if you're dealing with a sensitive client. You can set them in ice, or you're dealing with a high end grade 3 or 4 acne. And when the client starts to say they got sensation or is maybe feel like the product burning or something, you'll take those globes out and it holds the coolness. They remain cold. And so you can take that and rub it around that area and you'll start to see that redness go away. A lot of times when people are Fitzpatrick 1, 2, and 3, and they go to get like brow waxing, face waxing, they will put the esthetician will put that cold stone or cold globe on their skin because 1, 2, and 3, you ain't got no melanin. Okay, so when you do pull that hair, you're gonna see a red. It's gonna look like a bruise, but it's not. You're gonna see all that blood come to the surface, and so you don't want your clients walking out with just red swipes all over their face. And so we put that cool towel, cool globes, cold stones, and aloe vera, and it starts to calm that inflamed area, that redness out. You also have lavender. Hold on one moment. Okay, so we also have the aloe vera. Remember, these things are cooling, and so they are attracted to things that are that may be warm. Also, when you look at your essential oils, you got lavender, tea tree, um, those are anti-inflammatory. So anything that says anti-inflammatory is going to pull that redness out. It's going to calm that skin down. Any more questions? Oh, did I answer that for you? Was that close enough?
Yes, and I do have another question.
Okay.
With these acne clients, we would limit the sting, correct? Because of the sensitivity and redness.
Absolutely. Absolutely. I need everybody to be aware of the steam. Let's understand what the steam does. It softens the skin, okay? But if the steamer is on too long, it can not only soften the skin, and the one, it softens the skin. Two, that steam starts to pull up, okay? It's like smoke. It starts to pull things up to the surface. That's all you want to do. That's 10 minutes. Seven, really, 7 to 10 minutes. We have been so used to using the steam throughout the entire facial. When you do have someone who's super sensitive and you got that steam on, the steamer goes from helping me out and being my partner to now the steam is working against me. All right. So now the steamer causes issues and discomfort with the client. So, yeah, we're talking 7 to 10 minutes, and then that's it on the face, on the back, but also on in the intimate areas. If you're gonna do a vajacial, limit that steam because the steam will start to work against you. Okay. Um, Brittany said, I've used volcano ash before. It also helps blood impurities. Yes, it is a big deal. When I tell you it's a big deal on the West Coast and even in Texas, that volcano ash, I've seen it also in Puerto Rico. I've seen it in Orlando. Uh, get you some volcano ash, and really you mix it with water, distilled water, and you mix it like a mask, so it looks like a mud. If you do a body treatment, but put it on the face. Whew, that's all I'm gonna say. You may get like a It can run. It can get expensive. Brittany, you remember how much you paid for it, or yeah, it can get expensive. But the volcano ash is
Sorry,
good.
sorry about that. I'm up here at the doctor's, but I have to go back and go check and look. But yeah, I remember. Yeah, it is pretty expensive. But I was just following everything they was telling me as far as like it pulls impurities, and my skin was like so smooth like a baby when they got done with it. It was really relaxing, really good. I should it made me want to go back and go do another one. It's been a few years.
Okay, that's good. That's good. That's good. But yeah, that makes me next time I go to a show, I'm gonna have to buy some. And I like to find those things we cannot find in other areas. So I'm glad you put that in there. And get us some volcano ash so we can test it out. But when we get ready to do, I want to also teach you body wraps. They use mostly a black mud, but you can use the volcano ash. So we may have to just order it and see where we are from there. Hopefully before the summer over with, we can do body wrap. Okay. Um, with the PCOS, I'm gonna pull some particular videos and said go out to our YouTube. We're gonna close out, Miss Candice, but I do want to move forward with Thursday PCOS and pigmentation disorders. And y'all, if you can specialize in acne or pigmentation
Or
disorders, huh?
you kind of muted out when you had said my name. I'm sorry. I couldn't hear you. What you say to me?
I'm getting ready to turn it over for your class.
Okay.
Um, for Thursday, we're gonna pick up PCOS and pigmentation disorders. Guys, look, if you trust anything that I've said, read everything, study everything, go to every class you can see on acne, on PCOS, and on pigmentation disorders. Pigmentation disorders, I'm talking about hyperpigmentation. I'm talking about just hypopigmentation, light spots versus dark spots. Because if you look at 10 people that you know, somebody will have an issue with their skin in that area. And I'm only saying study that area because you don't find many people that look like you. Y'all catch what I'm saying? that have a common and growing knowledge of skincare on this level. What am I trying to say? If you're trying to go work at top-notch spas in the city or wherever you go, they are impressed by the knowledge that you bring. They're going to teach you, every place you go that has training, they're going to reteach you how that spa works. You just need the basics. Anybody can learn how to do visually anything, okay? But you need to have a common understanding of solution. Why, what type of acne and what's that and how do we fix it? And then PCOS, do I ask the questions? Okay, where are we with this? Have we also consulted a physician? Things of that nature. All right. And also when it comes down to hyperpigmentation and hypopigmentation or any kind of pigmentation issue, how do we get that to look amazing? And so that is going to be the root of an esthetician. Now, you may do as many lashes, body treatments, facials. You are the bum at all your practicals. I take nothing from you. But I need you to crack that book a little bit more. And I say this to my day students and night students. Crack the book. How you determine how far you go is how much knowledge you know, and then you know how to apply the knowledge. There are so many people waiting on you, and so many people have issues. There are so many people every day that turn 40, that turn 50, that turn 60. Guess what the goal is? I want to look like a 20 years younger. How do you do that? And you do that with the knowledge that you're gonna gain. You have so many people with issues with their skin. You don't just want to put makeup on and cover it up. I want to treat the skin. How do you do that? You got to learn to know what you're looking at. What's the cause of it? That's why I wanted to train your eye on the acne grades 1, 2, 3, and 4. We may have tons of words that describe these, but I need you to learn this for yourself. And you only will learn it if you stop trying to learn like everybody else. Okay? So I just want you guys to study that. I will see you tomorrow in the classroom, and I may have some pictures that we can talk about. But tomorrow, we definitely got to get our hands working on some waxing and microdermabrasion. I got the microdermabrasion machines out. So facial with microdermabrasion. Also, I got some dermaplaning tools I'm going to give you. And then also we need to look in, let me see, waxing, dermaplaning, and microdermabrasion. That's what we need to look at tomorrow night. All right. Other than that, I love you guys. See you later. Thank you, Miss Candace. Let me make you host. I'm gonna make sure.
Okay.
And I'm getting some things. I'm gonna go back to the chat. Somebody had something. You hit it right on here. Yes, yes, yes. I want you to, and here's the thing, I want you to be the expert. That's what you do come to school for. They should not, YouTube is an access, it's a resource. So it helps you and it helps them. But they should not be going into the beauty supply store and just random person working behind the counter asking what they should get for their skin. Okay? That person is making a sale. They should not just be going to Walmart and Target and saying, I'm gonna use this. No. Okay? They're going to make the money and they're going to pull you out, and you're not going to be considered the expert. So I need you to become the expert, and you only do that by having the knowledge. Okay. Let me go back over here to my participants, and Miss Candace, make you the host. Okay. Have a blessed and amazing day, Miss Candace. You're good. Call me if you need me. Okay.
Yes, ma'am. You have a good one too.
All right, y'all. See y'all in class tomorrow. Be safe.
Miss Candace.
Yes, ma'am.
I'm heading on now because I'm at the doctor's and I'm gonna step to the back. So I'm gone for the night. Y'all have a good night, okay?
You too.
All right, yes, ma'am.
All right. Hey Kendra, good evening. Let's wait to see if Lauren's gonna pop on, and then we'll get right into the handout if you have it with you. That Miss D gave us on last week, on last Wednesday. So do y'all have y'all handouts from last week with you, ladies? So that we can go over our handout on tonight. Okay, well, since both of y'all don't have y'all handout, I'm just gonna find us a hair removal video. And with that being said, also, make sure y'all take some good notes because I'm gonna ask you a couple questions about the video and what it was pertaining to, and give me a little feedback on it. So give me just a second, and let me find us a video right fast.
I like to take care of my patients, but today I want to talk about laser hair removal. So I thought, what better place to bring you than my office? So let's go. All right, guys, so there's 3 different types of laser hair removals, if you guys didn't know, and I'm going to talk about each one because some are good for different skin types and some are more painful than others. So follow me. This is my amazing staff. This is my PA Natalie, Alyssa, my esthetician Selena. So this is where all the action behind the scenes happen. So let's check out the first 2 lasers. All right, so this is one of my treatment rooms where I keep the Cutera laser. The Cutera laser actually has 2 lasers in one, 2 of the hair removal lasers that I'll be talking about. Before we get started though, don't forget to rate, review, and subscribe, and I'd love to hear from you in the comments, so make sure you comment below. So what is laser hair removal? Because a lot of people don't understand what that means. They think it's the same as electrolysis, which is completely different. That just removes the one hair using an electric current, whereas laser hair removal uses a laser beam. So it's a one wavelength of light that targets the pigment in the hair follicle. And that's why laser hair removal does not work, unfortunately, for blonde or gray or white hairs. Now, red hair has a little bit of pigment, and when I say pigment, I mean melanin that the hair follicle produces. And so if you don't have that in your hair root, there's no target for the laser. It just doesn't see it. It can't see it to remove it. That's also the reason why it only works on growing hair, because hairs can have 3 different cycles. And if they're resting, then they're not producing any pigment or any melanin, and therefore the laser again doesn't see it. So the light comes out of the laser handpiece and targets the pigment, converts it to heat that then destroys the hair follicle forever and ever and ever. The problem is we are born with billions and billions of hair follicles, and that's the reason why it takes multiple sessions to really see a reduction, because we're only targeting the growing hairs. There's going to be a whole new set of hairs that will be coming in for your next laser hair removal session. The most effective, the most potent type of hair removal, and that is the ACNE laser. It has a wavelength of 755 nanometers, and it is ideal for somebody with really white skin and really dark hair. So we can play with the settings to make it effective for different variations of that. But if you do have a darker skin tone and maybe finer hair, then a different laser called the YAG laser, and that's a 1064 nanometer laser, is a better option for you. It's safer because that wavelength of light actually goes deeper and doesn't affect the melanin that's in the surface skin. So that's why it's safer, because it doesn't burn the surface skin, and it bypasses it and goes more directly to the hair root, and therefore the 1064 laser is safer for darker skin tones. Now, the denser, coarser the hair, the more painful and the more robust the reaction. Because the ACNE laser is the most effective, it's also the most uncomfortable, and it goes a little bit slower when you're getting the treatment done, because it can be like little rubber band snaps. And the handpiece of the laser, you can see, is relatively small. I'm going to show you the 3rd type of laser hair removal. That's the fastest. So if you have coarser hair, you're going to have a little bit more discomfort. Sometimes the places that you may go to will offer cold air. They may also offer numbing cream. We offer that in our office, which helps. The first session tends to be the most uncomfortable, but as the hair density reduces, your subsequent sessions will not be as painful, because you have less target, less hair for the laser to catch. Okay, so the last type of laser hair removal, it's technically not a laser, but it's more of an intense pulse light. It's called Forever Bare hair removal. It's still a permanent type of hair removal, so I'll talk about the advantages of that. This is my little numbing nook, and this is where you would come and you would sit with your numbing cream on your legs or your face. Typically we numb for about 30 minutes to an hour. It just makes the hair removal a lot more comfortable. So this is the numbing nook. So let's go check out the IPL hair removal. Okay, so this is an IPL, actually a BBL, same thing, hair removal device. You can see how the handpiece is very different than the other one that I showed you. The handpiece is a lot larger. The benefit of this is it's a lot less painful. The drawback, it's not as potent. So it may take more treatments with this, but this is a lot faster, a lot less painful. So I love this for backs, legs, large areas that can be uncomfortable. This really cuts it down to probably half the time. So sometimes what I tell patients is start with this first, okay? Especially if you have a lot of hair, or particularly men. And so you could start with this, reduce the hairs down, get your hair density down, and then switch to the laser that I showed you earlier, because the laser is going to be a lot more potent, but this is still pretty good. The other downside is it doesn't work really great for darker skin tones because they're at greater risk of complications, for burns and so forth. So if you've got really dark skin, I would be very cautious with this because this is a little bit more high risk. It generates a lot of heat that can burn the surface of the skin. So let's talk about the do's, the don'ts of laser hair removal. One is you do not want to shave, pluck, pull the hairs out at least 6 weeks before your appointment. And the reason being, if you remove the root, then you remove the melanin that's the target for the laser. So if the root is not there, the laser doesn't see it, it will not work. So be sure that you're only shaving up until 24 hours before your laser hair removal appointment, or you can shave the morning of. You do not want to leave any hair on the surface of the skin when you go in for the treatment, because what happens then, the laser beam or the light will capture the hair on the surface of the skin, and it will reduce the energy that gets delivered to the hair root, and it chars the hair on the surface of the skin, which is like this really awful smell. It smells like burnt hair, and many of you probably know what that smells like, and you do not want that. So definitely shave the morning up. Be sure that you do not have an active suntan. So you want to be as fair as possible, because if you have extra melanin on the surface of the skin, again, that's the target for the laser. We don't want it on the surface of the skin. We want it just selectively in the hair root. So no tan, don't do spray tans. Go in with clean shaven skin without any moisturizers or anything on your skin. So you want to schedule your appointment every 6 weeks. Don't do it any closer, because that's when you get a whole new set of hair follicles growing in, and you want to capture the new hairs in the growing cycle. So every 6 weeks is what your appointment schedule should be like. And I would recommend doing 3 to 5 sessions. You still need a little bit of maintenance, like once every year, a couple times a year, just to maintain your results. Because remember, we're born with billions of hair follicles. After your appointment, you're going to see little tiny red.
If you have a dog or a cat, I'm going to put you on to my #1 pet parent hack to saving money. And that
Almost like pimples around the hair follicles, and that's called perifollicular edema. That's a good sign. That means that there's inflammation around the hair follicle that is dying. So you want to see that. But a lot of times people develop almost like an acne-like reaction. So I usually suggest that couple weeks before your appointment, use like a glycolic salicylic acid spray, like the Glycol body spray is great. You can spray that every night on your legs or wherever you are treating. If you're doing your face, you can use a Retin-A, or we have these Clarify pads that have glycolic and salicylic acid in them. But those chemical exfoliants will help with breakouts after. And then right after your treatment, you can use a calming cream, like Soothe HC is one to use. It has a little mild cortisone as well as aloe. You can apply that to the skin. It will help calm the inflammation down, reduce your chances of pigmentation and breakouts after. You want to be gentle to the skin, so don't have laser hair removal and then go out and schedule a chemical peel like a day later or a week later. You really want to stay away from other types of procedures for a good couple of weeks after your treatment, and probably also before. So many of you ask me about at-home hair removal devices. Again, they're not going to be anywhere near as powerful as an in-office treatment. The amount of energy they generate is very, very small compared to in-office. They have their place for maintenance, and you can check out my video on at-home laser hair removal devices. So thanks guys for tuning in. I hope that was helpful and it gave you some insight and some guidance into laser hair removal in the office and all the different options. So if you have any questions, comment below. And if you're on Instagram, follow me at Skin by Dr. Ozzy, and check out my TikTok, Skin by Dr. Ozzy. And I also have a podcast called More Than a Pretty Face. So would love to hear from you. Send me a DM. Till next time. Hi everyone.
Good morning, little nerds. It's Saturday morning. It means it is Pillow Talk Derm time. So get your pens and papers out, get your asses out of bed, and let's jump in. I am Dr. Shireen Idris, a board certified dermatologist, and today we are going to tackle laser hair removal and how best you can help yourself when it comes to this topic. Because a few weeks ago, I posted a shorts video on laser hair fails, and the outrage in the comment section was insane, especially from you nerds who told me that you guys experienced the same thing in the video where your hair was not shaved and you developed burns and discoloration and hyperpigmentation. So I thought to myself, let's dive in, let's understand laser hair removal so that you can best help yourself, so that you do not fall into that situation and you do not end up with burns on your face. So without further ado, laser hair removal. But small PSA from a dermatologist and a personal opinion. Any laser device, the outcome is only as good as the provider doing it, based on their knowledge, based on their education, based on their ethics. Laser hair removal specifically, because it is so widely popular, it is easy for the layperson, the consumer, to think, I don't need to spend a lot of money, I can get this down the road at a hair salon or at a nail salon. But the reality is, the number one reason when it comes to burns in patients from laser devices comes from laser hair removal, because it is so widely done without consideration taken into account that people are putting themselves under really intense devices and getting burnt in the process. So go to a reputable provider. That's my PSA. Understanding how a laser works is also very important for you to know why it matters for you. Knowing how a laser works is going to help determine which laser or which device you want to use. A laser is not a light. A light is many different wavelengths. Think of the rainbow. A laser is a specific wavelength of light. Laser hair removal works through a process known as selective, and that is a key word, photothermolysis, where that specific wavelength of light gets absorbed by pigment, in this case, the root of the hair, and converts that wavelength, that energy, into heat so that the root of the hair self-destructs. The word selective is key because you want the root of the hair to absorb the energy from the laser and not the surrounding tissue, because if the surrounding tissue absorbs it, what will you
Believe it or not, baby, at University of Phoenix, you
get? Discoloration, hyperpigmentation, and an unwanted burn. And that is why for years, the ideal candidate before we fine-tuned the technology was somebody who had dark hair with very light skin, because the laser would only target the dark hair without affecting the lighter skin. And that is why for so many years, people of darker skin tones felt like they couldn't get laser hair removal up until now. So what are the devices on the market that you need to look out for? The first one is a warning, and this is the one that you find everywhere because they're cheap. That's great, and that's also really bad. And they're often marketed as a laser, but they're not really lasers. They are known as IPLs, which stand for intense pulsed light. I just explained to you guys the difference between a light and a laser. An IPL is a light. It is not a laser. It emits light at various different wavelengths that the provider can cut off in order to target different skin tones and different issues. My biggest beef with IPL is that IPLs are not consistent. An IPL device varies from manufacturer to manufacturer in terms of the energy and the power that it gives off. It's not like a laser, which is calibrated to a specific wavelength of light. The energy and the power can kind of vary depending on the manufacturer. It's like saying, I'm gonna go buy fruit, but then you buy an apple. An apple is definitely not the same thing as a mango. Everyone knows a mango is like this and an apple is like that. And that's sort of what an IPL device is like. Depending on the manufacturer, it varies. So if you are gonna get an IPL treatment for laser hair removal, A, try to not be as melanated or tanned, because it's probably gonna not be the right choice for you, and if you wanna reduce your risk. And B, you wanna be damn sure that you're getting the Rolls Royce of IPL devices. So that's IPL. When you're talking about lasers on the market, there are several different types. The first one that came to market for laser hair removal was a ruby laser. We're not gonna waste our time talking about that. The other three that people often hear about are the diode laser, which is better if you are fair to medium skin tones. And the two most prominent ones are the Alex laser, which is a 755 nanometer, which can work really well from light to olive skin tones. It works very fast, but it is painful. And the Nd:YAG, which is a 1064 laser, which is great for darker skin tones because it bypasses the melanin in your skin when it targets the root of the hair. The issue with the Alex is that, with the Nd:YAG, is that it's not great for fine or very light hair. In my office, I have a device that combines two lasers in one, where you have an Alex and you have an Nd:YAG, so that you can blend the different wavelengths at the same time in order to target various hair types and skin tones at once. Because some people are darker here, lighter here. It just depends on the body part. That leads me to, why does that matter to you? Because now you have an understanding of what is better when it comes to laser hair removal and what you need to run away from or ask more questions about. We now understand that lasers can work on various skin tones, but what about hair colors? Because one of the biggest misconceptions around laser hair removal is redheads. Redheads do not respond as well to laser hair removal. It doesn't mean they don't respond at all. It just means they're going to need many more treatments. Why? Because the pigment in a redhead is very different than the person who has brown or black hair, and the laser is not geared towards targeting that sort of pigment. The best laser, if you are a redhead, is probably the Alex laser, but you're gonna need many more treatments. If you have white hair, laser hair removal is not for you. It will never work on somebody with white hair. You should instead opt for electrolysis. If you're a redhead or if you're very, very blonde and you found that you cannot either afford the number of laser treatments that you need, or that you've tried it and it still hasn't worked for you, electrolysis is also an option for you. People with PCOS. PCOS is a condition in which you have a hormonal imbalance as a woman, and you tend to have more hair along the jawline, your neck, your chest, your belly button. Patients with PCOS come into my practice every single day, and I hear this every week: I am not a candidate for laser hair removal because of my PCOS. That is simply not true. The reality is, with PCOS, because you have that hormonal imbalance, you are going to ultimately need more treatments to get to the end result that you are looking for. It's not gonna happen as fast as in those who do not have a hormonal imbalance. So when it comes to PCOS, patience is the name of the game, and taking a longer term view on it, anywhere from 18 to 24 months, is probably what you're looking at to achieve your desired results. Do not feel sad by that timeline because I'm going to explain to you that timeline in a second. But PCOS patients remind me of patients of Mediterranean descent or Middle Eastern descent, in that there's a subset of patients who also develop something known as paradoxical hypertrichosis, where they get increased hair growth when undergoing laser hair removal. This tends to happen sometimes in the short run with patients with PCOS, as well as, like I just said, Middle Easterners or people of Mediterranean descent. And I have seen this in my practice as well. Like with PCOS, people with paradoxical hypertrichosis need more treatments over time. And they need to do them at a lesser intensity with precautions like cooling and icing in order to minimize any sort of heat damage that might trigger more hair. But it doesn't mean that that hair is going to stay there forever. It just means patience is the name of the game, and you now have an understanding of a risk that can come up. The risk, by the way, is anywhere from 0.5% up to 10%. And you know that if you're patient with more treatments over time, you will get to your end result of really not needing to wax or shave as much. So that is something I definitely wanted to hit on because it is something you should go into with eyes wide open. Which leads me to, when do you see results? Most people will require anywhere from 6 to 10 treatments spaced on average 6 weeks apart. So it will take anywhere from 12 to 18 months total in order to see results. It's not something that happens overnight, and it's something that happens progressively over time. First, you'll notice a decrease in density of hair, and then you'll also notice a decrease in the thickness of your hair where it becomes thinner over time. This session is also very depending on the anatomical area, but again, patience, and it's not a key golden number that applies to everybody. How do you prepare for treatment? Let's go back to our laser hair video fail. You shave the area. You shave the area before coming in that day, because you do that out of consideration for your provider so there isn't hair all over the floor of your provider's office, but also in order to make sure that your skin is smooth and your skin barrier is not broken or inflamed by the time you get to your provider's office. You also shave between treatments, and you avoid waxing or tweezing, because when you are waxing or when you are tweezing, you are pulling the hair out of the root. And when you go in for your next treatment, it's not a guarantee that that hair is about to grow back. And the laser may not actively see the root and will not treat it as efficiently or effectively. And so you're ultimately wasting your dinero if you are shaving or waxing between treatments. Now, before you go in to your appointment, you want to also make sure that you avoid any sort of exfoliating acid or retinoid for 3 to 5 days before, so that your skin is not as sensitive and it is as less likely to burn in the process. You also want to make sure that you are not tanned, because being tanned will increase your risk of hyperpigmentation or discoloration. And ideally, you do not have any sort of self-tanner on your skin as well, so that the laser can truly function and truly separate any sort of color from your skin and the hair, and it can work to its best capacity. Use a clean razor, switch it out, use some shaving cream, and try not to stretch your skin while you're shaving, because when you stretch your skin, the hair can retract and go under the surface of the skin, and you can get ingrown hairs in that process. What about now aftercare? Avoid the sun. Don't go out into the sun because you're going to be a little bit more sensitive, and try not to exfoliate for a few days afterwards, again, because your skin will be a little bit raw. You do not want to irritate it in the process. And like I said, only shave, do not wax, do not tweeze. Now, what about laser home devices for laser hair removal? I am not a fan, because most of the time these are IPLs, and like I said, if an IPL at a provider's office can vary from manufacturer to manufacturer, imagine an IPL with an at-home device, which is not regulated at all, how that can vary from manufacturer to manufacturer. And if you are somebody who is even slightly melanated or who has a tan, you just increase your risk of a burn unnecessarily so. Plus, the energy and the power that that device is going to emit is going to require that you do hundreds of those treatments over time in order to get to an end result. So with that, I hope you guys enjoyed this video. Now you are better educated. Now you know to shave the area. I forgot to mention eye protection, but each laser comes with eye protective wear that you want to protect your eyes from the actual laser or light device. But now you know how not to get burnt, literally or figuratively, in the process. I'm Dr. Shireen Idris. Have a beautiful Saturday, and I'll see you guys next week.
Do this to see if insurance covers GLP-1s. Huge news! GLP-1s like Ozempic could be covered by your insurance. Ro has a free insurance checker that anyone can use to find out if your insurance covers GLP-1 weight loss medications. It's super convenient, no complications.
So y'all saw two videos talking about like what the different types of the let me go back. Hair removal for different types of skin and the pros and cons of hair removal. So with both of the with both of the videos, they gave some significant information, especially like about how to prevent yourself from being burned, and as well as the different type of machinery that is used when it comes to hair removal and stuff like that, especially if you are using some type of laser removal. And just like the lady just said, far as that you should have eye protective wear on when you are getting these certain um services provide done. Um what else was that? Oh yeah, the lady said far as like waiting 30 minutes to an hour once you get numbed and stuff like that. So that is good that they do offer numbing and creams or whatnot, so that you don't have to feel the pain of the hair being removed. And just like when we was doing the waxing on last week, you know, when you doing that waxing, you have to really go head on, you apply it and press it down, and then go head on and go on, take that wax off, because the longer it sits, the more embedded that hair gets into the on that wax, and the more it may tend to hurt. It just depends on the person, because some people have a different type of pain, take pain differently. So you have to be cautious about that. Far as like with the laser, like she said, it was like four, maybe four different type of machines that could be used, and um each one of them did something different. And I think I heard her say, when you have more melanin in your skin, it'll tend to cause some type of reaction. So I just wanted to get a little feedback from y'all, from you ladies, because I know it's 7:50, and it's almost time for us to wrap the evening up. So, um, give me just a little feedback, ladies. What did y'all take from both of the videos? The one that talked about the different skin types, as well as the one that talked about the pros and cons. What were y'all takeaways? Great. I love that. I love that. Um, and I did hear when she said about the redheads, as well as when she said about shaving before getting your laser removed. So great job, Kendra. That was really informative. Lauren, what about you? What did you take from the video? That's good too. I also pay attention to when she's talked about the blonde and the white hair as well, and the gray hair. Um, and both of you guys had some great feedback on both of the videos, and um, I always tell y'all I appreciate that for paying attention, and you know because that's something that we're touching on right now, as far as with the waxing and stuff. So I think that was really good. Y'all both did really well with the feedback. So it's 7:53, and is there anything else y'all want to add to the videos? What y'all learned from on last week? Give me one thing you learned on last Wednesday when we was doing the waxing. Come on, Kendra, cause baby, both of y'all was talking about something that was y'all both was excited about. So, what was it? What was one thing y'all learned on last Wednesday when y'all waxed my underarms? Okay, yeah, don't get out in the sun afterwards. That's cool. That's good. But what was one of the takeaways y'all got on last Wednesday uh when y'all shaved under my arms? What did you learn? I'm just gonna I'm gonna refresh our memory. When y'all take when y'all said, "Oh, it's bleeding." Yeah, well that because y'all was excited about the blood part. And I'm like, am I supposed to be bleeding? Really? Somebody make me understand, but um that's good far as the practical. I know Kendra, you had a little more practice in when it came to the waxing because when we was in the other building, you you got to participate then. So I really yeah, take the wax out fully before spreading it. Yes. Like I think Kendra and Miss Shanice was saying, like make sure you have enough on there. Make sure it's cool. It and cool down. Place it on there, from the front of the stick to the back of the stick. Then get to spreading it. So yes, that was really good. My arm still feels smooth, and my underarm it still look good. And when it comes to waxing, it takes their hair a little bit longer to grow back in, which is a good thing. I guess that's why so many people decide to do the waxing versus the shaving, because if you ever notice, when you shave, within a week's time, you will start seeing those little hairs up under your arm coming back through. But like I said, it's about to be another week. I don't see any hair under my arm. And again, my arm, the part where my lower arms and stuff where y'all waxed it, they're still smooth. So that's really good. That's really good, and that's just a little more information, for y'all to take in. But it's 7:56, ladies, and thank you all again for your feedback. They let me know that you're paying attention, that you're taking notes, and um, I just really, really want to be able to get us onto these mannequins. That's really my goal because I know Kendra, you are so close to walking out the door. I don't know how many hours Lauren has, but I know she's pretty close with you, and I do want y'all to be able to, execute the practical just as well as the theory. So, with that being said, hopefully on tomorrow when y'all come into the building, if it's not anything that we having to do other than waxing, we're going to get on our mannequin, and I'm going to stressed it a little bit more to Miss D about the practical part. So, ladies, I just want to say thank you again. And I was telling the ladies earlier when we got on, she Miss D said to give something out encouraging. Today was a rainy day. It was rain and it was cloudy, but in the midst of that, with the clouds, we're still here. And with the rain, think about what the rain produces, what the rain does. It makes something grow. So with y'all being in this profession, I just say let the rain on you so that whatever it is in your profession, it'll keep growing. So with that being said, ladies, I want to say love, peace, and hair grease, and y'all have an amazing evening.